Measles vaccinations may soon be available and given in pharmacies as the government rushes to ramp up the immunisations and halt the spread of the disease. There's been 1,868 confirmed cases this year, with 1,507 of them in Auckland alone. Over a third of those people in Auckland have been hospitalised. The Associate Health Minister, Genter, says 6-month-old babies in Auckland will now get a free vaccine, and nationwide all children under 15 who haven't had their MMR vaccine can get immunised. Over 107,000 vaccines are being distributed across the country now this week, with another 155,000 to arrive in the country over the next 3 months. Now, the announcement comes as questions are raised about the measles epidemic in Samoa, which has already claimed the life of a toddler. After a vaccination tragedy in Samoa last year in which 2 young children died, the immunisation rate has plummeted, leaving the country vulnerable. Health authorities there say it's highly likely a person travelling from Auckland to Apia for a conference carried measles, and there's now 7 confirmed cases there. I took cameraman Nick Monroe to Papatoetoe High School in South Auckland. Actually, he took me. And we asked Genter and began asking her how worried she was about the worst outbreak we've had in 20 years.
We're still at risk of future outbreaks, and that's why it's so important to get our immunisation rates up. So I'd encourage everyone with children under the age of 15 especially to make sure that they've had at least 1 MMR vaccine. Stick to the schedule. In Auckland, that's 12 months and 4 years. The rest of the country, it's 15 months until next year, when it was going to be 12 months anyway. And then now we have babies 6 months to 1 year can be vaccinated. This year, 300,000 people have been vaccinated. We've delivered 300,000 vaccines across the country, which is twice as much as in the entire previous year. And we're going to be looking to deliver a lot more over the next 3 months.
And just a question about adults who are concerned because they're being turned away. They might be people that in their workplace are exposed to children as well.
Yeah.
We know that these things have been spread. We've had one man with encephalitis as a result. So what about people who are being turned away? Can you hearten them with some news that they will be able to get their vaccines as well?
We do have now plenty of vaccine with the 107,520 and another 155,000 confirmed in the next 3 months, over the next 3 months. And so it'll be a clinical decision for people's GPs if they are in an occupation that means they're more vulnerable or working with the vulnerable, then it's very likely that GPs will be giving them the vaccine.
Okay. I want to talk about Samoa because we do have a responsibility to look after the Pacific. The WHO did send out some warnings earlier on. We've known that Samoa has a very low take of vaccinations because of that tragedy last year. 2 young children died. It was a human error thing, but people in Samoa do not have faith in the vaccination program, which only really kicked in again this year. So no more than probably 30% uptake in that country. It does seem highly likely that we have exported it there. The Director General of Health has told us that it's very likely that it came from someone attending a Methodist church conference. And so we've had a tragedy there now that 1 young toddler has died. A quarter of the tested cases have just come back from Melbourne have tested positive, for people mainly in Apia. What blame does New Zealand have for this?
Well, I know for sure the New Zealand government, through the Ministry of Foreign Affairs and Trade and the Ministry of Health, are on standby, very ready to support Samoa. And we want to ensure that we're helping in any way we can with their current outbreak.
But did we do enough beforehand? I mean, why not travel bans on people that weren't immunised to go back to Samoa, knowing that the big chunk of people with with measles in this country are from South Auckland, most of them probably Samoans?
I can't speak to the specifics of whether a travel ban would have been practical or the right thing. I mean, it was not something that was recommended by our technical advisory group. So what we've been really focused on is increasing immunisation rates, increasing the number of vaccines that are out there, and tracking down and trying to quarantine the outbreak in the areas where that's happened, and certainly standing by to help in any way we can with the situation in Samoa.
Knowing that we've had this problem for around about a year now, have we been sitting on our hands thinking, wow, this is going to get to the islands, they are pretty vulnerable? Have you had communications over that last year with MFAT about issues with Samoa?
I have asked questions. I think the difficulty with measles is it's just so highly infectious, and people are basically infectious before they know that they're sick. So it makes it very difficult to screen at the border for it, because you could be carrying measles if you haven't been immunised, and you won't come down with it for 2 weeks. So that's what makes it quite difficult.
Stop kids getting into schools if they couldn't prove they were immunised. Could we have done that perhaps to stop people travelling to the vulnerable countries if they may have had it?
Look, I asked those questions about what could be done at the border, and my information was that the best thing we could do is increase vaccinations and share information with those countries. I mean, all of our measles cases were imported. Our outbreak is due to people coming in with measles, I think, from 9 different sources this year. With this increase globally in measles, everybody, and with the amount of travel that happens globally, it is a problem, and that's why it's so important to get vaccination rates up.
Did MFAT drop the ball there?
I can't speak to that specific issue of whether or not there should have been a travel ban. All I can say is that we've delivered a record number of vaccines in the last 10 months, and we are going to be delivering another record number of vaccines, and that's, as far as I understand from the technical experts, the best way to stop the spread of the disease.
That's Associate Health Minister Julianne Genter there. RNZ has put questions to the Foreign Affairs Minister Winston Peters about those Samoa issues. He declined an interview today as he was travelling. Counties Manukau DHB says in the height of the outbreak, which has plateaued, it gave 10,000 vaccines plus another 6,500 at the pop-up clinics it set up in South Auckland, and there's been hundreds more in schools. 25 nurses are still in schools. There's more training going on. Overall, it's urging people to be proactive and see their doctor.